Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is dysthymia and cyclothymia and the difference between the two. Dysthymia and cyclothymia are both classified as mood disorders, but they differ significantly in their patterns, severity, and the way they affect daily life. Understanding them requires looking at how they present, their clinical features, and what distinguishes one from the other. Dysthymia, also known as persistent depressive disorder, is a chronic form of depression. Unlike major depressive disorder, where symptoms may appear in intense episodes, dysthymia involves a long-lasting, low-grade depressive state. Patients with dysthymia often describe themselves as having always been gloomy, pessimistic, or lacking joy. They might struggle with low energy, poor self-esteem, difficulty concentrating, and feelings of hopelessness. While they are usually still able to function, holding jobs, maintaining relationships, and meeting responsibilities, their quality of life is diminished. Because the symptoms become part of their sense of self, many do not recognize that what they are experiencing is depression. To meet diagnostic criteria, symptoms must persist for at least 2 years in adults and 1 year in children or adolescents. The hallmark is not necessarily the severity of depression, but its persistence. The risk of developing major depressive disorder on top of dysthymia, sometimes called double depression, is significant, which can further complicate treatment and prognosis. On the other hand, cyclothymia or cyclothymic disorder belongs to the bipolar spectrum. It is characterized by chronic mood fluctuations involving periods of mild depression and periods of hypomanic symptoms, without ever meeting the full criteria for a major depressive episode or a manic episode. The hypomanic phases in cyclothymia might bring increased energy, restlessness, reduced need for sleep, heightened sociability, or bursts of creativity. However, these episodes are not as extreme or destructive as full-blown mania. The depressive phases, while not as deep as major depression, still involve sadness, fatigue, and withdrawal. Over time, the cycling nature of these mood swings can create instability in work, relationships, and self-image. For diagnosis, these mood changes must persist for at least 2 years in adults and 1 year in youth, with symptoms present at least half the time and with no symptom-free intervals lasting longer than 2 months. Patients with cyclothymia are also at risk of developing bipolar 1 or bipolar 2 disorder later in life, which makes early recognition important. Let's look at the key differences between these two disorders. While dysthymia and cyclothymia both involve chronic mood disturbances, they are distinct in nature. Dysthymia is essentially a long-standing, low-level depression. The mood is consistently down, steady in its bleakness, and not interrupted by elevated states. It is the persistence of sadness and lack of vitality that defines it. In contrast, cyclothymia is not about being consistently depressed, but about cycling between opposite poles, mild heights and mild lows. Instead of stability in sadness, cyclothymia brings instability through mood fluctuations. Another key difference is the emotional tone. Dysthymia patients often appear subdued, wary, and resigned. Cyclothymia, on the other hand, is more unpredictable. Someone might feel upbeat, energetic, and talkative for weeks, then slip into discouragement and lethargy. This alternating pattern creates challenges for self-perception, since patients might feel they cannot trust their own moods or remain steady. Treatment also reflects these differences. Dysthymia is often approached with antidepressant medication, cognitive behavioral therapy, and lifestyle changes to manage the chronic depressive state. Cyclothymia, because of its bipolar nature, might respond better to mood stabilizers or antipsychotic medications, along with psychotherapy aimed at recognizing mood patterns and preventing escalation into more severe bipolar disorders. In short, dysthymia and cyclothymia both represent enduring mood disorders, but they affect patients in very different ways. Dysthymia is marked by an unrelenting low-level depression that shapes one's outlook over years, while cyclothymia is defined by oscillations between mild depression and mild hypomania that create an unstable emotional landscape. Both can undermine daily functioning and long-term well-being, but the path they follow and the strategies for managing them differ considerably. Recognizing these differences is essential, not only for diagnosis, but also for guiding patients toward the most effective forms of treatment and support. May the light of truth and supreme consciousness illuminate us and love transform us. Until next time.